Hello, Mr. Ahmed and friends. First of all, let me introduce myself. My name is Joshua Bryan from 12 Science 3, and today I'm going to tell you guys about COVID 19. COVID 19, or coronavirus, is a disease first identified in Wuhan, China, has been named coronavirus disease 2019, aka COVID 19. CO stands for corona, V stands for virus, and D stands for disease. The COVID-19 virus is a new virus that is linked to the same family of viruses as severe acute respiratory syndrome or SARS and some types of common cold. Coronavirus or COVID-19 is an illness caused by a virus that can spread from person to a person. The virus that causes COVID-19 is a new coronavirus that has spread throughout the world. COVID-19 symptoms can range from mild or no symptoms to severe illness. Know how to COVID-19 is spread? You can become infected by coming into close contact about 6 feet or 2 arm lengths with a person who has COVID-19. COVID-19 is primarily spread from person to a person. You can become infected from respiratory droplets when an infected person coughs, sneezes, or talks. You may also be able to get it by touching a surface or an object that has a virus on it, and then by touching your mouth, nose, or eyes. Protect yourselves and others from COVID-19. There is currently no vaccine to protect against COVID-19 for now. The best way to protect yourself is to avoid being exposed to the virus that causes COVID-19. Stay home as much as possible and avoid close contacts with others. Wear a mask that covers your nose, mouth in public settings. Clean and disinfect frequently. Touch surfaces. Wash your hands often with soap and water for at least 20 seconds. Or use an alcohol-based hand sanitizer that contains at least 60% alcohol. Practice social distancing, buy groceries and medicine, go to the doctor, and complete bank activities online when possible. If you must, stay at least 6 feet away from others and disinfect items you must touch. Get deliveries and take out and limit in-person contact as much as possible. Prevent the spread of COVID-19 if you are sick. Stay home if you are sick, except to get medical care. Avoid public transportations, ride sharing, or taxis. Separate yourself from others, people, and pets in your home. There's no specification treatment for COVID-19, but you can seek medical care to help you relieve your symptoms. If you need medical attention, call ahead, know your risks for severe illness. Everyone is at risk for getting COVID-19. All older adults and people of any ages who have serious underlying medical conditions may be at high risk for more severe illness. You should seek medical care if you or your child has a fever, cough, or difficulty breathing. Consider calling ahead to tell your healthcare provider if you have traveled to an area where coronavirus has been reported, or if you have been in close contact with someone else who has traveled from one of these areas that has respiratory symptoms. So we must protect ourselves from coronavirus is by two kinds of tests. They are available for COVID-19. They are viral tests and antibody tests. A viral test that tells you if you are a current infection. An antibody test might tell you if you had past infections. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, blushy lips or face, you must stay home for 14 days after your last contact with a person who has COVID-19. Be alert for symptoms. Watch for fever, coughs, shortness of breath, or other symptoms of COVID-19. If possible, stay away from others, especially people who has at high risk for getting sick from COVID-19. Thank you. So thank you, Mr. for this presentation. Goodbye.